So in this set of videos, we're going to take a deeper dive into how changing the ways in which we pay for medical care or changing payment can then lead to changes in healthcare delivery. In other words, the things you pay for are the things that you actually get. And many people feel that the way in which we've paid for medical care has kind of led to some problems in medical quality and the costs of care. And so changing that is a big priority of a lot of healthcare reform. In this video, I'm just going to give a high-level overview of where we're going to go. So as you remember, I'm going to write this in green since we're talking about money. The traditional way we've paid for medicine, medical care, health care, has really been through what's called fee for service. And as you remember, it's when every little thing you do, like, taking a pill, going to see the doctor, getting an x-ray, going to the hospital, all those things get added up in these little bills, and then you take all those and then you sort of just sum them up and you get one big bill. And this has felt to kind of have a lot of the wrong incentives because every little thing you do kind of makes more money for the healthcare system. And so the healthcare system, meaning the doctors, the hospitals, everybody, nobody really is invested in trying to make those costs lower because kind of the more you do, even the less efficient you are, the more money you actually make if you're a doctor. And so a lot of folks in healthcare have thought, well, how can we change the way we pay for it so that we can make healthcare better? And so there's a whole spectrum of that. And the first step along that spectrum is something called pay for performance. And we're going to have a whole video on this topic. But the bottom line is that in pay for performance, we actually try and measure healthcare quality. And your healthcare system, either your doctor or hospital, has to then report that quality to whoever's paying for it. Say it's Medicare or private insurer, and then they look at those, and then you may get paid a little bit more if you do well on those measures, or a little less if you do poorly on those measures. So that's thought to kind of make some of the incentives to deliver care a little better, but it still relies at its heart on fee-for-service care. The next step along that line is what's called a patient-centered medical home. And this is kind of a concept where suppose you have a lot of people who use a certain doctor's office. And we all like when our doctor would answer our phone calls or answer emails, kind of check on you. But under fee for service, none of that stuff was really paid for. So the patient-centered medical home, one of the ways that that changes those incentives is every member gets a small amount of money that's sent to their doctor. That's called a per member per month, and that could be like around $5 to $10. So suppose your doctor has a whole patient panel. In other words, their office sees 5,000 patients. So if they get $5 for each of those patients, that's a good amount of money. That's say $25,000 per month. And that extra amount of money right there is there so that they could do all those things like kind of check up on you. So they might check in with nurses, or they might answer your phone calls or emails, and then maybe even have people who'd call to make sure you're taking your pills. So it's kind of like a way of making sure that they offer an enhanced level of service. And on the back end, they also probably check to make sure that their patients are healthy and they're delivering good quality care. Now, the next phase along this transformation from fee-for-service is what's called bundled payments. So if you think about how we pay for medical care right now, if you kind of go see your doctor and you end up going back to the hospital, everybody gets paid more. So there's maybe not that much of an incentive to do a good job every time they see you. So what a bundle does is it takes all the little pieces of a pretty common procedure, say a knee replacement, And instead of having them each build little by little, just puts it all together into a bundle. So your insurer or Medicare or whoever the payer is doesn't pay lots of little bills, but instead sort of gets one price. And that price covers everything related to the knee replacement, the surgeon's fees, the anesthesiologist's fees, the cost of the device, the hospitalization, everything. It's a very different way of paying for care, and the idea is that if you pay a fixed fee, then suppose somebody, after they leave the hospital, gets readmitted, or they get an infection, or they don't feel well and they kind of go to the emergency room. All those things in the past would have led to higher costs under fee for service, because every time that happened, your insurer had to pay more. Since there's a bundle of care, none of those charges are allowed. So, none of that really benefits your physicians and your providers. And so as a result, they don't want to see anybody get admitted. They want to make sure that you don't get infections, that you don't go to the emergency room later. They want to kind of make sure the quality of care they deliver is high, because every time this happens, they don't get paid. So the idea is if you bundle services together, that is going to lead to higher quality of care, hopefully at lower cost for these kinds of episodes or bundled medical issues. The next phase along this transformation of healthcare delivery is what's called accountable care. And accountable care works like this. Suppose, I'm just going to draw a box around there, you have a population, maybe a couple of thousand people. And remember, each of those people typically has a premium that either they pay or their employer pays to kind of create a pool of money that's used for their health insurance. Now, if you take all those people and put them together and you pool all that money together, that actually can be a fair amount of money. So let's sort of pool all their resources together, and then you take that whole pool of money and then it becomes paid to what's called an accountable care organization, or ACO. And what that is it's like a group of doctors, nurses, hospitals, clinics, sort of everything you need. And then so for that overall price, they need to take care of that entire population and whatever happens to them. So in other words, it makes a health system have to work within a budget. They don't get paid more and more for all they do. They get paid only a fixed amount. And as a result, let's think about the incentives. Suppose that ACO gets paid this amount of money. I'm just going to draw a little bar like that. Now, that's sort of their fixed budget. So they do a really great job. And in fact, they only expend this amount of money on taking care of their patients because they're so good. Look at this kind of area right here. They keep a proportion of that money. That's what's called shared savings, because the insurer saves money and then those savings are then split with the ACO. So they're incentivized to do more with less money, because if they do, they get kind of a bonus payment because they keep that difference. On the other hand, suppose they don't do a great job and they spend more than what their budget was. Then they have to eat that cost, that bit right there. So that's essentially the risk that they take. That's how you incentivize a system to do a good job on the behalf of patients. And in the videos, we'll explore this concept in a lot more detail. I'm going to touch on one last way of paying for care that actually doesn't really fall into any of these categories. All of these still depend on paying the healthcare system, doctors, nurses, hospitals. The final way of paying for medical care is what's called population health. So I'm just going to put that here because it really doesn't fit into any of these categories. In population health, we typically don't think about just paying doctors and nurses. We actually think about creating a healthier environment. We all know that an ounce of prevention is worth a pound of cure. How do we do that? So population health is saying, well, look, why don't we invest in communities? Have sidewalks and safe streets people can walk on and exercise. Maybe they won't have high blood pressure and high cholesterol and get diabetes. Maybe they won't smoke as often. So population health is sort of taking this really the biggest change in payment reform, taking really money away from the healthcare system altogether and instead investing it in communities to make them healthier. And we'll talk about that as well.